Your liver performs over 500 functions every single day. It filters your blood, builds protein, stores energy, and fights infections. But here is what most people never think about. When your liver starts failing, it does not just quietly shut down. It sends visible distress signals to your skin, your eyes, your nails, even your breath. And most people have no idea what they are looking at. Liver disease kills 2 million people every year worldwide. That is 1 out of every 25 deaths on the planet, according to data published in the Journal of Hepatology. And here's the number that should stop you cold. Up to 38% of the global adult population now has some form of fatty liver disease, and most of them do not even know it. Your body might be screaming for help right now. The question is whether you can read the signs. Some of these will surprise you. But if you stay until the end, you will know exactly what to look for and what to do about it. This video is for educational purposes only and is not a substitute for medical advice. If anything here sounds familiar, talk to your doctor. The ghost nails. Take a look at your fingernails right now. Your nails are one of your liver's favorite places to leave a message. In liver disease, doctors look for Muirch's lines, horizontal white bands that run across the nail. These lines are not in the nail itself. They are in the tissue underneath. Press down on the nail, and they temporarily vanish. Release, and they come back. Your liver produces a critical protein called albumin. Think of it as the glue that keeps fluid inside your blood vessels where it belongs. When your liver is damaged, albumin drops. That change shows up under your nails as those ghostly white lines. There is another nail change even more striking. Terry's nails. The entire nail turns pale, almost white, losing its normal pinkish color. Tiny blood vessels under the nail normally give it that healthy pink tone, but liver disease alters the tissue, hiding those vessels completely. Here is a quick self-check. Look at the base of your nail for the lunula, that small half-moon shape. If you can see it clearly, your nails are probably normal. If your entire nail looks washed out and the lunula has disappeared, that is a signal worth investigating. Your nails do not lie. They are a window into what is happening deep inside your body. The diamond test. Here is a test you can do right now. Put your index fingers together, nail to nail. Do you see a small diamond-shaped gap between the nail bases? If yes, that is normal. If the gap is gone and the nails press flat against each other, it is called clubbing. The tissue between the nail and the finger bone thickens, pushing the nail into a rounded shape. Clubbing can signal problems with the heart or lungs too. But, combined with other signs on this list, the liver moves to the top of the list. Researchers believe clubbing may be linked to changes in blood flow and oxygen levels that occur when the liver is not filtering properly. Your fingers are literally reshaping themselves in response to what is happening inside. The yellow warning. This is where the science gets truly alarming. Jaundice turns your skin and the whites of your eyes yellow. The cause is bilirubin, a yellow substance produced when your body breaks down old red blood cells. Normally, your liver processes bilirubin, packages it into bile, and sends it out through your digestive system. When your liver is struggling, bilirubin backs up into the bloodstream. Research from the Mayo Clinic indicates that even mildly elevated bilirubin levels can produce visible yellowing. It often starts in the eyes before it reaches the skin. And here's a detail most people miss. Your urine may turn dark brown or tea-colored, while your stool may become pale or clay-like. That color shift is bilirubin leaving through the wrong exit. If you see yellow where there should be white, do not wait. The invisible itch. Imagine an itch that never stops. No rash, no visible cause, just relentless, maddening itching that gets worse at night and robs you of sleep. This is one of the most overlooked signs of liver disease. Your liver produces bile to help digest fats. When the liver is damaged or bile flow is blocked, bile salts accumulate in your bloodstream and reach your skin. Research published by the American Association for the Study of Liver Diseases shows that up to 80% of patients with certain types of liver disease experience this kind of itching. The cruel part. Standard antihistamines do not work. This itch is not driven by histamine. It is driven by bile salts irritating nerve fibers directly. Persistent, unexplained itching, especially on your palms, the soles of your feet, or all over your body with no rash in sight. Your liver may be the source no one is checking. The fluid trap. But the next sign is the one that catches most people off guard. A swollen, distended abdomen that looks like pregnancy, but is actually filled with fluid. This is called ascites. In advanced liver disease, the abdomen can fill with up to 15 liters of fluid. That is about 30 water bottles trapped inside your body. Here is the mechanism. All blood from your digestive system flows through your liver via the portal vein. As liver disease progresses, scar tissue blocks blood vessels inside the liver, creating a traffic jam called portal hypertension. Because of all that backed up pressure, fluid leaks through vessel walls and pools in the abdominal cavity. Portal hypertension forces blood to find alternative routes through tiny veins never designed for heavy flow. Around the belly button, these veins expand and become visible under the skin, creating a pattern of swollen, twisting veins doctors call caput medusa, named after the snake-covered head of Medusa. That pattern is not cosmetic. It is a visible map of your liver's distress. The red palms. Turn your hands over. In a healthy person, palms have a uniform pinkish color. But in liver disease, the fleshy areas at the base of the thumb and outer edge turn bright red, while the center stays normal. This is palmar erythema. Your liver breaks down estrogen. When damaged, estrogen accumulates. One of its effects is dilating blood vessels. In the palms, where vessels are close to the surface, this creates visible redness. The same imbalance produces another sign. Tiny blood vessels on the skin dilate and form spider-like patterns called spider nevi. Press on one and the blood disappears. Release and it refills from the center outward. Having one or two spider nevi can be normal. But research suggests 3 or more may indicate elevated estrogen. Red palms combined with spider patterns. Your liver deserves attention. The silent meltdown. This one sounds subtle, but the mechanics are undeniable. Muscle wasting happens so gradually you might not notice until you see an old photograph. The muscles in the hands thin out. The temples hollow. The limbs lose definition. Your liver processes nutrients, builds proteins, and stores energy. When damaged, it can no longer do these jobs. The body, desperate for fuel, starts breaking down its own muscle tissue. Research from the European Association for the Study of the Liver confirms that muscle wasting is a significant predictor of poor outcomes in liver disease. Your body is eating itself because your liver cannot feed it. The flapping tremor? Hold your arms straight out. Extend your wrists and spread your fingers. For most people, this is steady, but in liver disease, the hands may begin an involuntary flapping motion. Doctors call this asterixis. Your liver clears toxins from your blood, including ammonia, a waste product from protein breakdown. When the liver fails to clear ammonia, it reaches the brain. This is hepatic encephalopathy. The ammonia disrupts steady muscle tone. Muscles briefly lose their signal. The hand drops, the brain catches up and contracts them again, creating that distinctive flap. In severe cases, ammonia buildup can cause confusion, personality changes, and loss of consciousness. There is one more clue connected to this process. When toxins like dimethyl sulfide build up in the blood, they are exhaled with every breath. The result is a musty, sweet smell called fetor hepaticus. If someone's breath carries that unusual odor, it may be one of the most urgent warnings on this list. The bruise map. Do you find bruises you cannot explain, bruises too large for minor bumps, or that take far too long to heal? This could be your liver sending another signal. Your liver manufactures most of your clotting factors. It also produces thrombopoietin, a hormone that tells bone marrow to make platelets. When the liver is damaged, clotting factor production drops. Thrombopoietin decreases, and the spleen often enlarges, trapping platelets before they can do their job. Studies published in the journal Blood confirm that coagulation disorders are among the earliest measurable changes in liver disease, sometimes appearing before other symptoms. Easy bruising is not just inconvenient. It is a visible sign that your blood's ability to protect you is compromised. Your body speaks a language most people never learn to read. Every sign we covered today, from ghost nails to yellow eyes, from invisible itches to flapping hands, is your liver trying to communicate before it is too late. Knowledge is your first line of defense, but your doctor is your second. If any of these signs sound familiar, consult a healthcare professional. Early detection changes everything. Share this with someone you care about. It might be the wake-up call they need. Comment, "I'm listening," if you are paying closer attention to what your body is telling you. Hit the like button so more people can see this. And subscribe because we are just getting started uncovering what your body has been trying to tell you all along. Stay aware, stay alive.